This training is intended to provide an overview of the ENvue system and its use. This presentation is only intended to be used in conjunction with provided instructions for use for the system and the feeding tubes. The ENvue feeding tube placement system is based on electromagnetic tracking technology. The cart comprises a large and swivelable touchscreen computer, storage place, electronics box, printer, and an electromagnetic field generator which is attached to an articulating arm. The field generator emits electromagnetic waves at a low frequency that covers the patient's entire thorax and the upper part of the abdomen. The ENvue feeding tube is a two-channel tube. The large channel is dedicated for feeding, and the small channel has a passive electromagnetic sensor at its distal tip. When the passive sensor enters the field of electromagnetic waves, it is activated, and any movement of the sensor within the electromagnetic field is identified by the system and presented graphically on the screen, allowing a pathway to be created. The cart is placed next to the patient's bed. The screen displays easy-to-follow setup instructions. The field generator is positioned. A reusable reference sensor is attached below the armpit of the patient. It allows for the system to stay accurate even if the patient moves during the procedure. ENvue is the only system that displays an actual outline of the patient's upper body. By calculating the distance of the reference sensor and the marking of two anatomical landmarks, an alignment is created between the patient and placement system and presented on the screen in 3 simultaneous views. Placement can now begin. The tip of the tube is displayed on the screen as a crosshair with an arrow before it, providing the orientation of the tube's tip. The arrow can change its color to red, indicating that the tube may enter into the airways. The position of the tube can then be immediately corrected so that the feeding tube can be deployed into the esophagus, and from there to the stomach and small intestine. Again, the arrow proves to be instrumental in providing positioning information for the clinician. The tube is then secured per standard hospital protocol. So, to summarize, ENvue uses electromagnetic navigation technology by means of an external field generator that creates electromagnetic waves that cover the entire thorax and abdomen of a patient. There are passive sensors within, the registration pen, the feeding tube, and the side reference sensor that are activated the moment they enter the field of electromagnetic waves. There are 2 easy steps that need to be taken in order to use the ENvue system and feeding tube. The first step is to create an alignment between the patient's body and the electromagnetic navigation system. The second step is to simply connect the feeding tube to the ENvue system. How does one create an alignment between the patient's body and the ENvue system? This is performed by, first of all, attaching a small sensor to the side of the patient's chest. This sensor not only assists in calculating the chest size, but also compensates for any movement of the patient during the procedure. Secondly, one marks 2 anatomical landmarks, the suprasternal notch and the xiphoid process, with a registration pen. The electromagnetic field generator combined with these 3 registration points allows the system to display a patient-specific body contour and tube pathway image. The tube pathway is displayed on the body contour in real time and is highly accurate because of the 40 per second image refresh rate that creates a tube image that responds immediately to user action, and our unique sensors with their 360-degree orientation, which provide steering directions via a white arrow for the feeding tube as it travels through the body. The ENvue enteral feeding tube is a 2-channel tube. The large channel is dedicated for feeding, and the small channel has an embedded passive electromagnetic sensor at its distal tip. The tube is ENfit compatible and comes in 8, 10, and 12 French sizes. ENvue is unique in the fact that the system displays not only the direction of the feeding tube by means of a white arrow, but also provides critical information to the clinician if the feeding tube may be entering into the lung airways. The ENvue system calculates the angle and constant position of the feeding tube, so that the moment there is a potential deviation towards the lung, the arrow turns red and a deviation message appears. The ENvue system is FDA 510(k) cleared and commercially available in the U.S. A multi-center clinical trial was performed at the Cleveland Clinic and St. Vincent Hospital in Indianapolis. The main endpoint was to demonstrate that there was an alignment between the feeding tube tip position on the ENvue screen and a post-procedural KUB to validate that if the ENvue screen identified the feeding tube in the GI system, it was not in fact in the lung. In total, there were 58 successful placements. All feeding tubes were placed in an appropriate anatomical position within the GI tract. Precise agreement of tube tip location was achieved between the ENvue evaluations and radiographics for 96.5% of placements. According to both ENvue and radiography, no lung placements occurred. No pneumothoraces were reported, nor any guidance-related adverse events. Thank you for watching.